Hey everyone, my name is Emaan Chaudry.
And my name is Danielle Solish, and today you're listening to the 26th episode of Seeing Clearly, which is our pre-clerkship guide to all things ophthalmology. On today's episode, we are going to be interviewing Dr. Alain Proulx.
So a little bit about Dr. Proulx. Dr. Proulx is a comprehensive ophthalmologist at the Ivey Eye Institute with a clinical interest in neuro-ophthalmology. He currently holds the position of associate professor at the Western University and was the director of the Western University Ophthalmology Residency program until July 2020, after 13 years in that post. Prior to entering medical school, Dr. Proulx completed a master's degree in neuroscience at Western University, and most recently, he completed a master's degree in medical education through the University of Cincinnati.
Both his undergraduate and postgraduate medical training were completed at the Schulich School of Medicine at Western University, with his neuro-ophthalmology training carried out on an elective basis during his residency at both the Kellogg Eye Center and the Kresge Eye Institute. Dr. Proux's main areas of academic interest include temporal arteritis and optic neuropathies, as well as medical education. In his spare time, he enjoys spending time with his family, skiing, traveling, playing games, and cycling.
So without further ado, we're really excited to introduce Dr. Proulx.
Great. Hi, everyone.
Hi, Dr. Proulx. Thank you for being with us here today. I guess we'll just jump into the first question here, which is, could you talk a bit about your journey to ophthalmology?
Sure. So my journey to ophthalmology was a little bit unconventional, and it probably started with a visit to my guidance counselor in high school, believe it or not, because when I was in grade 11 or 12 or so, I really had no idea what I wanted to do. So I filled out one of these aptitude tests and sat with my guidance counselor. And she said, you'd be a great optometrist. And I didn't know much about it. So I decided optometry sounds like a great idea. So I actually applied to optometry school. And not optometry school, but I applied to the University of Waterloo with the goal of maybe going into optometry. So I started my science degree at the University of Waterloo in the pre-optometry program with the goal of hopefully going into optometry eventually. But like a lot of students from a small town in Northern Ontario, I was ill prepared for the challenges of the large city of Waterloo, let's put it that way. So my first couple of years didn't go quite as well as I wanted academically. And I applied to optometry at first and didn't get in. So I finished my undergrad and I wasn't sure what I wanted to do. So I decided I'd go to grad school because I really didn't want to get a job. I just wanted to keep on with my education. So I applied to the neuroscience program at the University of Western Ontario, did that 2-year master's program with the goal of maybe going on to an academic career and pursuing a PhD. But I found that after being in the master's program for a year or two, although I really enjoyed research, I don't think I could see myself as a career researcher. And so I was once again caught in the middle of a situation where I didn't know what I wanted to do any further. So one of my good friends who was in school at Western said, well, why don't you apply to dental school? And I said, yeah, dental school, that sounds like a great idea. I'll be done in 4 years. It's a pretty good job and stuff. So I decided I'll apply to dental school. And another friend of mine who was in medicine said, well, if you're going through all that trouble, writing the dental aptitude test and all that, they said, why don't you apply to medical school? I said, medical school, why the hell would I want to do that? I never thought of medical school, and it wasn't a dream of mine growing up being a physician. So I applied to both dental school and medical school and got into all 3 medical schools I applied to and didn't get into dental school. So then I figured, well, I guess I'll go to medical school. And so here I was in medical school, not knowing much about it. Because I hadn't researched it or anything. It was never a lifelong goal of mine. And the only person I knew in medicine in London at the time is Dr. Tom Shadow, who is now an ophthalmologist with us at the Ivey Eye Institute. And Tom and I did our undergrad together at the University of Waterloo, and he kind of took a circuitous route as well. He went to teachers college, he did a master's degree in math, but he was at that time a first-year resident in ophthalmology. So I said to Tom, Tom, here I am in medical school. I don't know what I'm doing. All these keeners in my class are doing electives. I don't even know what an elective is. I said, can you give me some guidance? So he said, well, why don't you come and, shadow me around at the Ivey Eye Institute? He was a first or second year resident then. And it was kind of ironic because I'd gone to school originally wanting to do optometry. Mm. So I said, okay. So I came to the Ivey Eye Institute and I shadowed him around and a couple of our consultants and really fell in love with the specialty. But I knew at the time it was really competitive. So I pursued a lot of other avenues. I was really interested in anesthesia. Back then we still had grades. It wasn't all a pass-fail system. So I kept my grades up, did what I could in terms of research and electives, and I got in. So this is how I got into ophthalmology, the kind of roundabout way of getting into ophthalmology through, a goal of going into optometry. And then when I was a resident in ophthalmology, my first or second year, one of the roles of the junior residents in Western is to run the emergency clinic. And we have a lot of opportunity to talk with, the local optometrists and things like that, because they refer a lot of patients to us. And I remember taking a call from an optometrist. I won't mention his name, but it was a guy that I'd done my pre-optometry program with in Waterloo. And so he'd been a practicing optometrist for a few years. I was still in, second year of residency. And it was funny because he said, oh, Alain Proulx, I remember a guy from undergrad named Alain Proulx. And I said, yeah, that's me. And he goes, what? He goes, you're just a resident now? He'd been in his practice for like 7 or 8 years or something. And I was still in second year of training. So it was kind of funny. I didn't actually start work as an ophthalmologist till I was almost 36 years old. So it's kind of a running joke in my family. I was in school for I guess it would be 31 years before I actually got a job. So my sister, who's 10 years younger than me, was working long before I was, and it's kind of funny. So.
Exactly. That's what happens with medicine. It's kind of funny though, because not only did you become full circle, but every program you honestly almost tried to do, when it didn't work out, it still brought you back to ophthalmology. So.
And it's kind of funny in hindsight when I look back now, I'm kind of glad where I ended up, because all these other jobs, and I probably would have been happy doing them, but I do find it very satisfying of being an ophthalmologist. So, people say, it's whatever, it's karma, or if things happen for a reason. But, in my situation, it was just by some misfortune that I ended up where I am now. And it's kind of worked out all well in the end,
Yeah, it's a misfortune that so many students absolutely love to do. Exactly. But no, that's incredible. And it's kind of nice that you had this connection that eventually brought you into ophthalmology, and it kind of just all made sense in the end. So
yeah. And afterwards, because the training in optometry is in Waterloo, a lot of the graduates in that program end up somewhere in Southwestern Ontario. So I actually know at least 8 or 10 optometrists that are practicing in the area that we cover as ophthalmologists. And I often talk to them, we sometimes go to conferences together, and it's kind of funny to, reminisce about our days in Waterloo and how they're nearing retirement. And I'm nowhere near that, because I didn't start working until I was 36.
Exactly. It's always nice to have the connections too. That's great.
Yeah.
Just a kind of a follow-up to this. So I know that we mentioned this a bit in your bio, but could you talk a little bit about your specialization in neuro-ophthalmology and how you were able to manage to do these electives in Michigan, and what you got from that and how it ended you up where you are now?
Yeah, sure. That's a good question. So in our program, like in many programs, but especially at Western, all of the core training is done by the end of PGY4, or almost all of the core training is done by PGY4. So residents have the opportunity to do a lot of elective work in their 5th year, and it usually entails pursuing, extra training in areas that they felt they may not have got a lot in their first few years. Or if people are interested in fellowship training, they might do electives at some of the centers where they might be interested in doing their fellowship. Or if they're interested in general ophthalmology, they might go spend some time in the communities where they might be interested in working, just to see what life is like in that community. So when I was entering my 5th year, my wife and I, we were married at that time, and she had a teaching position in London, and we really wanted to stay in the London area if possible. And so I approached our chair at the time, Dr. Phil Hooper, and said, what would it take for me to stay on in the department here in London? Because we really like the city and I really like the department. And I did have a keen interest in neuro-ophthalmology and in teaching. So I said to him, I'm not sure if we need a neuro-ophthalmologist, but that would be something I'd be willing to pursue. But I really wanted to do comprehensive ophthalmology as well. So he said, well, if you do the majority of your elective training in neuro-ophthalmology in your 5th year, almost like a mini fellowship, then you could do a combined comprehensive and neuro-ophthalmology practice and come back and work for us, because we needed extra people at that time. So, and he also said you should probably do most of it out of London, just to get a broad-based exposure to how the training is done in other places. So I did about a 2-month rotation in Ottawa, which I truly enjoyed. And then I'd met Dr. Jonathan Trobe, who's quite a renowned neuro-ophthalmologist. I'd met him at a conference, so I reached out to him and said, could I come for a few months and spend time with you? And he said, great. So, Ann Arbor, Michigan is fairly close. So the the Kellogg Eye Institute, which is at the University of Michigan, was where I went for a few months. And while I was there, he said, there's this other really good neuro-ophthalmologist in Detroit called Greg Van Staveren. He was currently at that time at the Kresge Eye Institute, which is affiliated with Wayne State University. So by that circuitous route, I did 2 or 3 3-month or so rotations, did about 10 months of my PGY 5-year training in neuro-ophthalmology, which wasn't all that much different than doing a full year fellowship. But then I got to do the comprehensive component of my practice. So when I came back to work in London, I do probably about 20 or 25% of my patient volume is neuro-ophthalmology, and the rest is comprehensive ophthalmology.
Wow, that's incredible. And it's amazing to see how one person led you to another, to another, to another. It's really great to see the collegiality and how, just meeting one person led to one door and then many doors, I guess, opening for you. And you mentioned it a bit earlier, but taking a step back, maybe from ophthalmology specifically, we know you completed a master's degree in medical education. Do you mind maybe talking to our listeners a little bit about the benefits that this brought to your career and what type of work maybe you do in medical education now and the importance of it to you?
Sure. So when I had approached our chair when I was a resident about working in London, one of my interests at that time was perhaps at some time becoming the program director, the residency program director, because I really had an interest in teaching. And at that time, I didn't really have much of an interest in other research. So I thought, teaching and education was a good area. Ironically, at that time, our longtime program director, Dr. Mike Matulko, had been program director for quite a long time and had been contemplating stepping down. So I think the department saw this as a good opportunity for me to transition in as program director from Dr. Matulko when he stepped down. And I said, well, what do you think about me doing this master's degree in medical education? So at that time, there were a few programs, most of them in the US, which were mainly for working healthcare professionals to do a master's level training program in education. There were a few others in things like public health and epidemiology. And at that time, there were 2 programs that were popular, one in Cincinnati and one at the University of Chicago. And so after approaching both programs, I thought the program in Cincinnati kind of fit my interest. It was more focused on teaching rather than on education research. So I did that. And the goal is it's kind of like it's kind of self-directed learning program. It can be done in as little as 14 or 15 months, but most people take 2 or 3 years if they're doing it as part of integrating it into their busy clinical practice. So it took me about 3 to 4 years to do it. And a lot of it was focused on teaching research and teaching methodology. And it's like a full master's program. You have to do a research project. You have to present it, along with a thesis. And the idea of that would be a useful skill set once I transitioned into the residency program director position. I didn't realize at the time that Dr. Matulko was hoping to get out of that position quicker than anticipated. So I actually took over as program director 6 months into practice. So, which probably worked out well because I wasn't that busy in my clinical career at that time. So it helped me transition to the program director role a little bit more smoothly than if I was really busy. And also starting my master's degree probably around the same time was a little bit easier because I don't think I could envision myself doing it, at this stage in my career, just with how busy I am. But it did help a lot, not only because it guided a lot of my research projects, especially early on, but it did help a lot, in restructuring our residency program to fit more with guidelines along the Royal College model. And some of the teaching techniques and methodologies I learned were quite helpful from that standpoint. And ironically enough, our current residency program director, Dr. Yanis Iordanos, he took over from me in 2020 and is still our program director to this day. He did the very same thing. So he started a master's degree in education, probably about a year into practice, and has since completed it and is still our program director now. But interestingly, the program he completed was through Western. So after I did that program, these similar programs kind of started springing up across North America. A lot of schools started, coming up with programs that were meant to give working academic physicians the kind of graduate level skill set they could obtain. And some of the key areas were education, of course, and like I said, public health, epidemiology, a few others like that were meant to be integrated as part of a busy clinical lifestyle rather than just a dedicated kind of one-year program.
Right. And yeah, we definitely see it more and more often. I see like residents all the time. They're doing a master's program while in their residency or like at the end of their residency. So Yeah, that's incredible.
Yeah, two of our residents that graduated last year completed during their residency completed a master's of public health through Harvard, and
Wow.
ophthalmology is a nice specialty because you can do that. Residency is very busy,
Right.
but it's not like neurosurgery or something like that. So I think residents who have the initiative and have the motivation can certainly do it within the confines of their residency program, and then graduate with a really attractive degree that makes them attractive to fellowship training, to attractive to academic programs across North America.
Yeah, for sure. It's like a really great skill set to have. And like you still get that learning in something different than just, always doing ophthalmology every single day. So that's great. I guess just on the same topic as medical education, do you have any advice for our learners? We get a lot of learners who listen to the podcast, like medical students mostly, but occasionally residents, just in terms of like how to succeed on rotations, like how to put their best foot forward, all of that.
It's a very good question because I think it's different for different styles of learners. Some learners have a certain learning style, and I think there's not an approach that fits for everybody. And I've said that to our residents many times. They ask, for instance, how should they study? How should they study for the Royal College? And not, different people have different styles of learning, and some people, work by rote learning. Some people, like cue cards and mnemonics. I think the same can be said as well for, working on clinical rotations, getting through medical school. So it's not so much that there's one way that fits for everybody. It's more so identifying what works best for each individual and then, trying to stick with it. The trouble is not everybody knows from the beginning what their best modality of learning is. So I think it's just a matter sometimes of trying different things. One thing I say to medical students and residents is not to focus too much on fine detail and the minutia, because that's something that I found as a learner is you spend a lot of time doing that and then you end up forgetting it very easily. So to focus on broad concepts and, standard approaches to common clinical scenarios. As far as advice for medical students in terms of getting into a residency program, because that's challenging as well, because the climate changes year by year. Some years we get a lot of applications, some years we don't get as many. Sometimes you have people who weren't successful one year, so they reapply a second year, and so they're thrown into the mix with people who haven't applied before. So as far as, balancing the learning in medical school versus making yourself an attractive applicant to a residency program, I think the best advice I can give is just to try to be as well-rounded as possible. I think sometimes people focus a lot on having the flashy CV with, all the research and the electives. And I think most residency programs now look for individuals that are more well-balanced. So it's not so much that, we look for people that have 50 publications or have this. It's more, people that have, varied interests. They travel, they play sports, and they've balanced that with their, some volunteering, and some research is nice too. It doesn't always necessarily have to be research in the area of specialty that you're applying either. So I think having a well-balanced application package is probably more important than being really stellar in one or two areas.
That's awesome. Thank you so much for the advice. And kind of on the topic of maintaining balance and being well balanced in terms of work-life balance, we were wondering what types of things you enjoy outside of ophthalmology and how you're able to balance it all. And maybe we can tie that into some advice for our listeners as well, given that, that previous piece of advice.
Sure. I don't think it's just, I think it probably took me a long time to realize this, but I think if you start early on, even in your medical training or even beforehand, is just to never forget that you have to make time for yourself and your other interests, because otherwise, if you focus too much on the academic side of things and the research side of things, you can really drive yourself crazy. From my standpoint, I will say that for your listeners who are interested in ophthalmology, it really is a nice specialty that balances, a variety of medical interests, like surgery and medical aspects of patient care, but with also a fairly reasonable lifestyle that allows people to pursue their other interests. And so it doesn't mean that ophthalmologists aren't busy. That's certainly not what I'm saying. I mean, if you spend a day walking in the shoes of any average ophthalmologist, you'll find yourself quite exhausted at the end of the day. But the pace and the hours are fairly reasonable. So for people who have other interests, whether they be academic or hobbies or otherwise, it is a great specialty that allows one to balance that. For me, I this time of year, our family is very interested in skiing. We do a lot of skiing. We do a lot of exercising together. We travel together. We try to do a lot of active traveling. So we're not a family to travel somewhere and sit on a beach. We like to hike and explore and things like that. And obviously during the pandemic, that's a little bit challenging. So we're just now getting back to a stage where we feel comfortable traveling once again. So that's been exciting because we've got a few little trips planned here and there over the course of the year. But getting back to your question about, in terms of giving advice, I mean, sometimes you get so focused on your academic training that you kind of put your relationships with other people and your other interests aside. And I think the one piece of advice I would say is to just make sure you make time for that. I remember at Western, and I'm sure it's similar at Queens and other places, medical students have the opportunity to do research in the summer. At Western, there's a formal summer research training program, it's called, and I'm sure other schools have something similar. And I think a lot of students are interested in that because it gives them experience in an area that they may feel maybe deficient in their CV or whatever. And I always say to students when they ask me about that, I said, listen, you got 2 more summers in your life, and that's it. Like, these are the last 2 summers you're ever going to have. Once you're a clerk, and once you're in 4th year, and then you start residency in the summertime. I'm not saying you shouldn't try to fit in some research, but if there's one piece of advice I wish someone had given me was, those 2 summers, do something, to travel, get an easy summer job or whatever. Just, it doesn't mean you can't balance it with research or other academic ventures, but really, make time for yourself. And I think this is probably one thing we've learned the last few years during the pandemic is all of us probably kind of suck at doing that, but we were kind of forced to do it again. So hopefully people have all learned to kind of reevaluate their priorities and kind of make time for what's really important.
Oh, yeah, it's great, especially with the pandemic when all of a sudden we were like inside and couldn't do anything. And then we were like, wow, we should have done all of these things. It's like,
Exactly.
a big indicator to do it. So thank you for all of that advice. We really appreciate it. Now that it's like kind of freezing rain, a little bit snowing, hopefully that it becomes a little bit closer to ski season. I know it got quite warm this week. Now we'll shift gears. Our first would you rather question is kind of a little bit similar, but I'll start off. So would you rather live at the top of a tall New York City apartment building or at the top of a mountain?
At the top of a mountain. That's a pretty easy one.
Yeah, I was going to say.
Yeah. I'm from a small town in Northern Ontario, and I love the excitement of being in a big city. And we love visiting big cities, but I don't think I could ever live in one. It's kind of funny. London's like a big small town. It doesn't have expressways or anything like that. It's kind of funny, but it's about as big a city as I'd want to live in. As much as I love visiting big cities and I love visiting New York, but I think being at the top of a mountain would be definitely a preference for me.
Makes sense. And you can get in as much skiing as you want if you're on top of the mountain too.
Exactly. Yeah.
For your next question, would you rather go without TV or junk food for the rest of your life?
Oh, junk food. I mean, I'm a bit of a TV addict, and I watch anything. I watch reality TV. We watch whatever. Sometimes we'll watch dumb TV when we're working out. And I don't eat a lot of junk food, although I do have a sweet tooth, but I could do without junk food. So that's a pretty easy one too.
I think that would be a toss up for me. It's hard.
No, I feel like TV goes with junk food most of the time.
Yeah, but when you come home from like a long day in the hospital, it's nice to just watch some reality TV.
Yeah.
With all of that wraps up our episode. So Dr. Proulx, thank you so much for coming. And then to all of our listeners, thank you for listening to this episode of Seeing Clearly. You can stay caught up with all things iCurriculum and check out our website at www.icurriculum.com or our Instagram at iCurriculum. Thank you for being here. It was incredible recording with you.
Great. Thank you. Appreciate the opportunity.